of the RCSI PA program, I'd like to welcome all of you. My name is Lisa Alexander. I am the director of the program. I'm a physician associate. I moved to Dublin in September of 2020 to assume this post as the director of the program. I had previously served as a faculty member and former director of the PA program at George Washington University in Washington, D.C. So I am thrilled to be here and to be meeting with all of you today, our first open event as we prepare for our upcoming admission cycle. So this webinar today is primarily to introduce you to not only the PA program here at RCSI, but also the PA profession across the country of Ireland. So Laura, if you'd be kind enough to advance the slides. So just a little bit of background about RCSI. As all of you may be aware, this is quite a institution with historical significance here in Ireland, having been established in 1784. It has a terrific rating with regard to higher education. It's in the top 2% for world ranking in 2019. Our students are span the different educational programs in medicine and health sciences. Currently, we have about 3,800 students total at the university. We have 4 international campuses, over 19,000 alumni, and 9,000 surgical fellows. The hospital group with RCSI includes 7 hospitals, not only located here in Dublin, but throughout the island of Ireland. And as I said, this is quite a remarkable institution from an educator standpoint because of the state-of-the-art facilities and our dedicated faculty. And the program, Laura, if you could advance to the next slide, the program has been in existence now for a few years. This is our 6th cohort that we just admitted. So the RCSI leadership has been extremely forward-thinking and supportive of the physician associate profession here in Ireland. We're the only program in Ireland, and I think RCSI has always seen itself as a leader in health sciences education. So as you can see, we have a number of factoids, if you will, that sort of give you a sense of what the institution is like. And over, I think, the last probably 20 years, the institution has taken a much more global outlook. And as I said earlier, we had 4 campuses with 68 countries represented. So we have quite an international population of students. And I think that the number of students that come to Dublin, not only for health and medical training, nursing training, physiotherapy, have wonderful experiences here at the institution. Laura, can I have the next one? So many of you may know what a physician associate is, but I'd like to just introduce it to you as a healthcare professional. And these PAs now number almost 40 in the country, and they are trained at the graduate level and qualified to provide medical services alongside physicians and nurses and all the other members of the healthcare team. And they do this within a defined scope of practice. And this would be under the general supervision of a physician, consultant, registrar, whatever level you are aligned with in your particular institution. Next one. Yes, so this particular slide, excuse me, I didn't have my glasses on. This particular slide just outlines for you the number of graduates that we've had. And I said earlier, we're up to 39 in the country, and we have another 29 students in training. And our PA Studies program offers students the opportunity to expand on their university first degree in the sciences by really drilling down into the medical science aspect of patient care. And so we would like to provide students with an opportunity not only to focus on, the patient-centric care, but also to take advantage of these wonderful simulation facilities that we have here. And those are facilities where students can go into a safe environment, practice their physical exam skills, also practice history taking and other skill development like EKGs, heart sound. So the simulation center is state of the art, and it's a wonderful opportunity for us to also engage in interprofessional training. So perhaps with nurses or physicians, and simulating these particular experiences, as I said, in a very safe environment. And the PA Studies program also requires students to complete a dissertation, which we'll talk about in a little while, but we do recognize the importance of quality and patient safety, and we try to provide students with opportunities to put those skills or that conceptual knowledge into practice during their second year. So the first year of the program and the second year of the program have different areas of focus, and you'll learn about that in just a moment. But the PA faculty includes myself, Dr. Pauline Joyce, who's our Director of Quality and Clinical Engagement, along with Professor Sean Robinson, who is the Director of Education, and Laura Kenna, who I'm sure some of you have interacted with already, who is our very skilled program coordinator. And can I have the next slide? And I believe this is where Pauline takes over. I can't see this.
Thanks, Lisa.
Thank you.
Okay, so just to give you the history of the PA profession, just very briefly, it's a global profession now, and you'll see the list of countries in a few minutes. But the current expansion of the physician associate role, it's also called physician assistant in the US, is a model which began in 1965 with Dr. Eugene A. Stead Jr. of the Duke University Medical Center. And really, he leveraged the experience of medics coming back from the Vietnam War. They came back with all of these skills and really were looking for where they could use them best. So they started using them in the rural areas of the US, first of all. So they set up an accelerated training model, which was very attractive at the time to solve acute workforce shortages. And the profession really started to take off from there. Next slide, Laura, please. So across the globe, you can see that the numbers we've listed here, they're even expanding, outside of this list. They're expanding all of the time. But you can see we've put Ireland up there because we've started our program in 2016, and we have a number of graduates, as Lisa showed on the slide there now. And in the UK, the profession has expanded hugely since 2015, and I'll say a little bit more about that in a few minutes, but you can see the other countries there. So it's right across the globe. It's not just Europe, it's not just the US, it's also Australia, New Zealand, etc. Next slide, Laura, please. So from the RCSI perspective, as I said, we started the program in 2016, in January 2016, we actually started the program, but in preparation for that, we recruited our first class in 2015, and that's the time where we set up a pilot project with our Department of Health here in Dublin to test out this model of having a physician associate on a team, and we tested it out in Beaumont Hospital on surgical teams there over a 2-year period. It actually started in July 2015. Our pilot project went on to October 2017, so expanded beyond the 2 years a little bit. And it was very positive, the results from the pilot project. So we started off with the first class, and a first group of students graduated in December 2017. So you can see that we take our groups in January and then they complete 2 years later in the December. So it's 2 calendar years rather than 2 academic years. So really it's equivalent to 3 academic years. It's quite an intense program. It doesn't have the same academic holidays as other programs that you would be familiar with in your undergrad or other postgrad if you've done that. So it's quite an intense program, and we'll say a little bit more about that as we go along. So you can see that we've expanded our numbers, but yet they're still small enough, because what we're doing is we're taking on students and making sure that these students have jobs to go to after they graduate. So we are quite active in working with employers as well to take on our physician associate students. And we do that right throughout the programme, in where we place our students for some of their clinical rotations, and particularly for their elective placements. And that's a placement at the end of the programme where they can choose where they'd like to go, with a view to working in that area once they're qualified. We're delighted to have 14 in our current year 2, and you'll meet our class reps a little bit later. They're on this meeting as well. And we have 15 students in year 1. Next slide, Laura, please. So this infographic, this picture here, it just summarises really, I suppose, what a physician associate can do, generally speaking, on a team, and can do a lot more than that as well. But I suppose, again, to go back to the growth and development, and we have here put since 2015, because that's when we really got working on this project, was 2015. But RCSI have been trying to progress this project for years and years back, well before 2015, have been visiting the US, etc. And I suppose the interest came from an RCSI perspective, with surgeons in their training going over to the US and Canada and seeing this model work so well in North America, and bringing back that concept of a physician associate as part of the medical team to Ireland. So in the US, we can see that the numbers have gone up. In 2015, we had a number of 108,000, and that's now gone up to 140,000. The 200 programs have increased up to 250. So this is we're looking at less than a 6-year time frame here. In the UK, we have they've increased from 100 physician associates to 1,200. And from 5 programs, when we started on this pilot project, there were only 5 programs in the UK, and this has now gone up to 35 programs. So in the UK, they have a faculty of physician associates, and under that faculty, they have a registry of all their qualified physician associate graduates. And at the moment, they're progressing the profession to regulate under the General Medical Council in the UK. And also they run a national exam there, like they do in other countries, for the physician associate, because this is a role with generic skills. And the UK have decided to set up their national exam, which can be taken every 6 years for the physician associates, and we've followed that route as well. So in Ireland, the Irish Society of Physician Associates was set up only in 2019, and within that society, we also have a managed voluntary registry and also have a national exam. And I know some of our members of that who are RCSI graduates are on this meeting as well today. So we're progressing quite well, in following other countries for this profession. Next slide, Laura, please. The MSc, the Masters of Science in Physician Associate Studies, as I said, it runs over 2 calendar years. For those of you familiar with the European Credit Transfer System, the Masters in total has 120 ECTS at level 9. So this is the Masters level award, level 9 of a 10 award framework. So what we're trying to represent here is that the modules in this Masters run simultaneously, not like your traditional undergraduate program where you would do a module, complete the assessment, and then move on to the next module. So we're trying to represent the curriculum as a spiral type of curriculum, where you start with, you can see from the key there, the foundations of clinical medicine, but also quite quickly you're moving with the clinical medicine and practice, and actually these happen at the same time. So when you come into class on a Monday, you could have a class on foundations of clinical medicine. The next class could be clinical medicine practice. The next class could be your pharmacology and therapeutics. And the personal and professional development will examine the role of the physician associate and your own personal development in that role. And then evidence-based practice in healthcare starts a little bit later, but we introduce you quite quickly to that through the use of journal clubs. What we're trying to show as well in this diagram is that clinical practice is at the centre of this programme from the very start. So you have the orange tunnel, I suppose, if you like, going through all of the spirals. So everything is applied to clinical practice. And we get clinicians also to teach on the programme, as well as our own faculty with their years of expertise in clinical practice. We also have tutors from the School of Medicine come in to teach on the programme, and our own physician associate graduates come in who are currently in clinical practice, also teaching on the programme. Next slide, please, Laura. I think, is this for Sean?
It is, yes. Thank you, Dr.
Thanks,
Joy.
Sean.
So welcome, everybody. I'm just going to pick up where she left off and talk a little bit more about the courses in the first year. So the Foundations of Clinical Medicine, which is essentially when you think of medicine, gastroenterology, renal, those sorts of things, that's covered in that course. And there's sort of a side module of anatomy, which does include human cadaver dissection alongside the medicine lectures. Clinical Medicine in Practice, or CMP, is a case-based course as well. So it goes into history taking, the physical exam, as well as some simulation exercises, which is applying what you've learned in FCM into what a simulated clinical environment might look like. Pharmacology and Therapeutics is much like it sounds. It's the drugs and how they work and when to use them. And that too is, as best we can, synced up with what is being delivered in the FCM course. The personal and professional development, as Dr. Joyce had mentioned, is what is a PA, what's their role in the clinical environment, but also beyond that, potentials for leadership, involvement with local governments, et cetera. So sort of starting point for how to go with your career after that. And then finally listed here is evidence-based practice in healthcare. So this is a sort of continuous course or module, if you will, throughout your program, culminating in this quality improvement project that all the PA students are required to participate in. And essentially what it's doing is giving you the tools to answer clinical questions while at the bedside with the patient, and also just looking forward to how to improve your practice using various research methodologies. Next slide. Laura, can I have the next slide? Thank you. So the program is focused on patient care, and essentially what that means is we take mostly a clinical focus as opposed to a quote-unquote basic science. So don't focus too much time on the physiology or biochemistry, although that is an important foundation of learning about the clinical portion. So a lot of it is focused on clinical, and that of course spills over to the clinical training, which is the latter half of your training. One-on-one mentoring and advice with PA graduates. Essentially, there's a buddy system where we will link you up with those who are in the second year. So first and second years can sort of exchange advice on how best to prepare and continue forward in the program. We do use a blended learning approach, which means we rely somewhat on online learning tactics, much more so in the last year because of COVID, although I do think that that's likely to continue to some extent in years to come. So we have been using Blackboard Collaborate pretty extensively through the last year. We do have a lot of simulation activities through our, if you're not familiar with it, hopefully you get a chance to research the simulation center at RCSI. It is a sort of world class. So we do simulations with things like mannequins, but we also have real patients or simulated patient scenarios to get you ready for that clinical experience and then ultimately for practice. You will be working across all healthcare environments, so it's important that you be trained in them as well. So we do cover all broad aspects of medicine and surgery, but not only in the first year, but also in the clinical year, where you get a chance to rotate through different clinical environments. And we do help you with clinical enhancement. This starts with that PPD course, but it continues into the clinical year and beyond, where we're helping you for counseling on best job placement, environments that might be ideal based off your particular skill set, helping you with CVs and interviewing skills, that sort of thing. A vital member of a multidisciplinary team is just a reference to the fact that we are part of the healthcare team. It's a growing role in Ireland at the moment, but we have to sort of get you used to this notion of it's part of the team, and you have to know what everyone's role is to make the outcomes in terms of patient care optimal. And then a variety and scope within your role as a physician associate is just giving you all the tools that you need so that you can jump into a variety of clinical environments when you're finished with the program and be a productive member of that healthcare team. Next slide, Laura. This is going back to you, Paula.
Thanks, Sean. So this is just a slide to show that we've used quite a lot of clinical sites in the past, and we continue to expand our clinical sites. And sometimes that comes to us from requests from people in organisations who are interested in employing a physician associate in the future. And other times it's because we're linked with different hospitals within the RCSI hospital groups. So it works well in our favour. We're quite flexible in the clinical sites that we send our students to. And again, there may be, as we said, people interested in employing a physician associate. And what we've found to work best is that if students, particularly in their second year, go to an organisation, the staff at the organisation can get to know what the physician associate role is about and can start thinking about where best this role would fit within their organisation, within their specialty. So you'll see from the public hospital perspectives, our first port of call is our RCSI hospitals group, Beaumont being our main teaching hospital, Connolly, etc. And Kappa Hospital, we've sent students to Waterford Hospital, we have a graduate at Waterford. We send our students to GP practices, mainly in Dublin, but also in other parts of the country as well. Our specialties, you get a flavour of obstetrics and gynecology at the Rotunda Hospital, paediatrics in Temple Street and Crumlin Hospital, and mental health at Bloomfield and Highfield. And also, we've also placed people in psychiatric specialty in Beaumont Hospital. You can see the list of private hospitals there that have been interested, and some of them, those private hospitals, provide scholarships to students as well. So we've a very good relationship with private and public across the remit with our physician associate role. And this picture here is a lovely photo of one of our recent graduates, Shanika, who's now working in Our Lady's Hospital at Navan Hospital. Thank you. Laura, next slide. And this is just giving a flavour of the assessments and resources, and I know you don't take assessments lightly, so I'm not passing over this, but I suppose what it's showing you is that we have a variety of assessments, so we're trying to make sure that we, I suppose, reach people who have different learning styles and make sure that, you know, you do succeed in the programme once you're a good fit for the programme, and that's what we hope for everyone joining the programme. So we have a lot of MCQ exams, and we are currently doing these MCQ exams online. We have short answer quizzes, and sometimes we use these as practice for students before they take exams that they will get marks for in their final award. We have clinical exams, so some of you might be familiar with the word OSCEs, where they're observed clinical examinations. We have assignments where you have to write up an academic piece for an assignment. We also have presentations where you need to stand up in front of the group of peers, or online, you have to present online as well. And this is getting you ready for presenting in the real world of clinical practice to your consultants, to your peers, to the multidisciplinary team. So we introduce these skills very early on in the programme. As Sean said, we use case studies as well, particularly in the clinical medicine and practice. We give you cases that, you know, patients have histories, you need to do their physical exams. So we use these quite a lot as well. We have a clinical skills passport, which is a booklet with all of the skills that you do throughout the programme that you need to get signed off on. So our our first year group have recently done a number of clinical skills in our simulation unit, and that was the picture you saw there of our students in their blue scrubs. So they recently did a lot of skills that had to be signed off, and then when they go into clinical practice, they have to get them signed off again when they practice them, etc. So this is a list of skills that you have in this booklet. Clinical rotation sign-off. Currently, we rotate students at 3 weekly intervals in different clinical specialties across medicine and surgery, and then we go to specialties after that. At the end of the 3 weeks, the student needs to present to a consultant or the next most senior person from the consultant. They present a patient's case to them and they need to get signed off on that. So there's a certain number of those they need for the year before they can progress from year 1 into year 2. And then in year 2, they need a certain number of those before they can actually be successful on the programme. And these are pass-fail sign-offs. Then we have a quality improvement dissertation, and this comprises a quality improvement project plan that you will work with people in the clinical team. When you start to go into clinical rotations, you will observe an area that could be improved for patient safety reasons or patient care reasons, and we use a framework which has Lean Six Sigma at its centre, and it's called the DMAC framework. So we prepare you for that in year 1, and you carry out this project in year 2, and this is part of your master's, and you're supervised doing that as well. The resources that we have access to on the programme, as well as our experienced faculty, we have physician associate clinicians, as I said, our own physician associate graduates, and they teach on the programme all the time. They teach the students when they're in clinical practice. And they've just come through their own training and, want to progress the profession. So it's fantastic.
No, I'm finished.
Sorry, can somebody turn off their audio? Can somebody turn off their audio, please, online? So we have PA clinicians. We also have an expansive online library that you get access to from the beginning of the programme. So we don't expect that people have to go and, buy any online journals, etc. They're all available through our RCSI library. We also have resources online such as videos. Our virtual learning environment is called Moodle. Some of you may be familiar with that already. And this is, as Sean alluded to, we're using Blackboard Collaborate for our online learning at the moment, and this is all through Moodle. The Simulation Centre, again, a few of us, we've made reference to that, which is a huge building on York Street, state-of-the-art building that we use for simulation and teaching clinical skills. And then we have access to our medical school and to other schools as well. So we work closely with the School of Pharmacy as well. And we've organised interprofessional learning sessions where all our students meet up and do some interprofessional learning sessions, mainly based around cases of students working to, so they work quite well. And following the Masters, we've put in national exam there. So currently the national exam, which is run by our Irish Society of Physician Associates, is their MCQ exams. So it's a big MCQ exam that is divided up. So lots of assessments, and I suppose the core of that is making sure that you're competent and safe to go and look after patients once you finish this programme. Next slide, Laura, please. Do you want to take this, Lisa?
I'll take it, Pauline.
Yeah, thank you.
So just a little bit of information about the professional organization that represents the physician associates here in Ireland. That is, as Pauline mentioned, the Irish Society of Physician Associates, where we have a website that you can certainly go to learn more about them. They are very active on social media, and they are very much the pioneers and ambassadors of this profession locally. And we are happy to support them in their strategic growth as well as advocacy efforts across the country. I think one of the things about becoming a physician associate that many people have a hard time conceptualizing is when you enter this program, you are oftentimes, there's some role confusion. And people don't really know what a PA is. So you're not only an ambassador for the profession, but you're also part of the growth and advocacy, because the healthcare system is changing, as many of you know, And this particular model is being embraced by many, many people across the Irish health system. And we want to graduate competent providers who have the highest quality of professional integrity and competence. And the Irish Society of PAs are committed to those particular values. And as you can imagine, being new to a system, you want to put your best foot forward. And it's incredibly important that we represent ourselves as a professional group that is committed to patient care and the ideals and values that are consistent with quality patient care. And our program, for those students who complete the program, successful in all their assessments, are given the opportunity to participate in the conferring ceremony in May, even though they graduate in January. They come back to campus in May. As we did last year, we will be conferring degrees virtually this year as well, and we look forward to that. So I think what we're going to do next is bring in our student representatives and our graduates to make a few comments from their perspective so that our attendees can get a better sense of the program from not only students who are currently enrolled, but also students who have completed the program. So, am I going to call on our student reps first? I think, why don't we start with Emma? There's Emma. Hello.
Hi. Hi, Lisa. Thank you. So hello to everybody. My name's Emma. So I'm year 2 physician associate student, and Paul and myself are the 2 class reps that we'll be speaking to you about our experiences. Paul, could you turn your sound off? Thanks. Just echoing. So just to talk to you a bit about my own background, what brought me to this course, and then I'll talk a little bit about what year 1 was like, and Paul will then talk to you about year 2 and the rotations. So my background is I was working as an assistant psychologist. I went back to study in my 40s and did a degree and a master's in psychology, and I was working for the HSE, which is the Irish Health Board, for those of you who don't know. And I really wanted to carry on and do something more medical. So the PA course drew me because it was medical. It was really the closest thing to getting to be a doctor, if you like. And I think as well from the financial point of view and the time span of it, that 2 years seemed to me very attractive, that after 2 years I'd be qualified and working where I want to work in hospitals and in a medical environment. So it was really a no-brainer from my point of view. And thankfully I got the interview and started this time, January last year, January the 20th, 2020. So we went straight into, as Pauline and Sean were explaining, it's a system by system course so that you simultaneously do the pharmacology, the anatomy, and the medicine of each system. So we've started, for example, with MSK, the musculoskeletal system, and then cardio and respiratory, and you work through every single system at a pretty fast pace, because it is only from January to September that you have the academic year, if you like. So it's clinical skills mixed in as well. We learn to take blood pressures, how to use our stethoscope, have cases each week, very quickly learn how to take histories. So the tutor might, imitate a patient with a particular illness, and we have to ask the questions to find out what is wrong with the patient. So from very early on, you're thrown into a very medical focused and clinically focused environment, which is really great. And I suppose to mention as well that we went into lockdown after, I think it was 7 weeks, and maybe to talk a little bit about that, what that was like. I wouldn't let it put anybody off. It was really well organized from an academic point of view. So much of it can be done online, as I'm sure you've all learnt. And really a lot of it is up to you to do the work. The resources are there. The resources are fabulous. There's a lot of online resources. The library's great. and even YouTube clips for clinical skills. But so much of that is provided, and you just really need to apply yourself to do it. So the virtual part of it, although it was tough not seeing each other, it was very workable, and we ended up going on schedule into the hospitals. So it it all really went very smoothly. And if I was to say what's needed most for the course, I think hard work for sure, which I'm sure you're all used to as undergrads, as graduates by now, and self-direction, I think, so able to manage your own time, manage your study, do some of your own, research and looking up things beyond what's taught, and really just to keep going. It is a fast pace, as everybody will tell you, but just to keep on going and keep moving, like leave behind if you don't know something fully, but just keep going. It all comes together, particularly on rotations. So I wish you all the best of luck, and we'll see a bunch of you soon. I'll pass you over to Paul. Thanks, everyone.
Can't hear you, Paul. Just turn on your sound. No. If you're beside Emma, can you use Emma's?
Can you hear me now?
Yep. We can't see you though. Now we can see you.
Now you can see me.
Yeah.
Okay. Hello, everybody, and welcome to the Open Day. My name is Paul. I came into this program last year as a 47-year-old mature student. My original degree was in applied physiology, and then I worked for about 25 years in as a fitness instructor and a team coach, while at the same time I did a degree online through the Open University at night. So I did a second degree in sort of biomedical science. So I chose everything. I could choose what courses I wanted to make up my degree, but I chose almost entirely medically related ones. I did this actually just out of curiosity. I had no plans, no career plans. But towards the end of the degree, I decided I didn't really like my old job, and it was a shame to do all the study without really using it. So I looked into doing maybe a master's degree in cognitive behavioral therapy or a master's in drug synthesis and design. Because if you can think about those two programs, like I wanted to help people from a therapist point of view, but I was really curious about science. So ideally, medicine would have been ideal for me because you're using science to help people. By that stage, I thought I was too old really to do the full medical degree, and I couldn't financially afford to do medicine. So when I heard about the PA program, I was really interested. I knew it existed in America, but I didn't know that it was even a thing in Europe, let alone Ireland or the UK. So I showed up for the Open Day, and at the Open Day, I decided there and then that I was going to commit to taking a 2-year pay cut, no income for 2 years, and really take a risk of sorts because it was a brand new profession and unregulated. Wasn't much awareness out there about it, but I wasn't going to be 85 years old and say, what if I had have done this? What if I had have done medicine? So I didn't want to have any regrets at retirement age. Why did I choose the course? Well, 2 years is not too long really, and even though it's really intense and very fast pace, I figured I could take the lack of income for 2 years for something that I really was passionate about. Even the salary at the end of it is not even a factor for me. I want to help people through science, basically, through medicine. What would I say you need to succeed on this course? Well, as Emma alluded to, I think you definitely need really good time management skills. You can't learn 5 years of medicine in 2 years of PA school. So you have to be really good at managing your time. It's probably more intense than the medical degree because of the shorter time frame. You sort of have to learn the same breadth of knowledge as the medical students, but possibly not to the same depth. But you have to be able to understand everything that they're talking about on the wards when they become doctors. Specifically for tips on study, I'd say I used learning outcomes of each lecture as a sort of a guide to guide my attention. So I'd be able to answer the learning outcomes at the end of the lecture. You need something. I needed that as a focus because there's so much information you just can't remember it all. And thirdly, when I was accepted onto the course, I pre-studied for 4 months before the course. I learned all of the clinical sciences, anatomy, physiology, pathophysiology, and pharmacology concepts. So that really took the pressure off for the first few months. I didn't really feel overwhelmed by the course at the start because of that. An overview of second year. Okay, second year, as both Professor Alexander and Dr. Pauline Joyce alluded to, is almost entirely clinical placement and the QI. So you'll be doing your clinical placement during the day and your QI in the evening. So you're not going to have a lot of time to waste, really. Again, you have to be really good with self-management. You do get some learning. We get one tutorial a week with a clinical tutor. It's online at the moment, obviously, but we also get to go to the junior doctor. That's the interns. They have teaching organised every week, and we're allowed to go to it. So it's taught by the other consultants. And any other learning opportunities that come up, I go to those as well as the incidental learning that happens on the wards, because the rest of your team that you're assigned to is always teaching you little things. You don't know when it's going to be, and it's not exactly organised, but it'll be bedside learning. It's sort of the application of your knowledge, which is, I guess, is the main focus of second year. How do you manage a patient? How do you approach a certain patient presentation? And I think the final thing that you need to seize on this course is you need compassion. You can always learn more medicine. You can always become more skilled at a procedure. But if you don't feel motivated to relieve patient suffering and to respect them as a person, I think this course is not for you. And finally, why would I recommend the course? Well, it's taught by qualified PAs from the United States, where the profession, they're able to practice to their full potential. They're not allowed to prescribe here, and you can't order ionizing radiation. But in the States, you can do everything. So that's what we're aiming to do by seeking regulation. And no better to push the people to push the program and to get it regulated are two people with years of experience as PA advocates. Professor Alexander and Dr. Joyce have well used to dealing with politicians and with the people who regulate, the stakeholders in healthcare, in the HSE. And a big organisation like the HSE, as you can probably appreciate, is very slow to change. So there's certainly going to be a lot of negotiation and advocacy activities required to push the programme and the profession ahead. So that's me in a nutshell. Thank you very much.
Thank you very much, Paul and Emma. I'd like to introduce Aaron Brady. Is Aaron on the call with us today?
Yeah, I'm here. If you can hear me.
I can hear you. Do you have a camera?
Yeah, let me pop it on there now. Yeah.
Thank you for being here, Aaron.
You're very welcome.
You can go ahead.
Yeah, perfect. Hi, how are you? Nice to meet you, and welcome to the PA Studies Open Day. My name is Aaron Brady. I suppose I'll just start again, just kind of with my background. So, I graduated from the University of Limerick in 2013 with a degree in general nursing. And kind of from there, then I went over to the UK and I specialised in critical care, intensive care nursing. I did 4 years over in the UK. And did my ICU or intensive care postgraduate certificate course while I was there. From there, then I came back in 2017 and I started off in the Mater in the intensive care there. Again, it was a new challenge for me. It's a completely new set of skills are required, and the patients that we looked after in the Mater were vastly different to the patients I encountered while in England. I don't know many of you are aware of the Mater, but it's the Heart and Lung Transplant Centre of Ireland. They do ECMO, which is a kind of extensive kind of life-saving bypass machine that works for both heart and lungs. And they do it also is home to the National Spinal Unit. So it was very challenging, very enjoyable to kind of deal with patients and learn the skills and knowledge base around looking after this kind of new set of patients. I suppose I came across this course while I was there. I looked into it in detail, kind of read studies about kind of what a PA is and what they can bring to the medical team, in terms of kind of the increasing team efficiency, continuity of care, kind of reducing medical team workloads, and just working as an integral part of the multidisciplinary team. I think even from analysing the studies, you know, the vast majority of studies out there are extremely positive and reflect extremely positively on the PA profession, and certainly, you know, the medical teams have really revealed the benefits of it. And I know from there, I think also from a nursing perspective, you know, I love nursing, and I think one of my major motivators was maybe to get a bit more autonomy, a bit more responsibility, and also kind of, I wasn't a fan of night shifts really. So I think the PA profession offered all that. You know, it was you know, as much as I loved ICU, I was like also kind of looking for a change. So the idea of being trained as a generalist through the PA program, which allows you to kind of switch speciality, and you know, in terms of the lateral mobility that's allowed with the profession, it was very, very appealing to me. Also, I suppose it's, you know, the kind of the Monday to Friday as well was nice, as well as avoiding nights. And yeah, I mean, when I looked into it, I suppose that being trained through the medical model, and the intensity of the program, was just very appealing to me. I always enjoyed a new challenge, and I was like, this is certainly something that, one, I'd upskill, I'd also increase my knowledge base, and two, kind of challenge me. It's also very, you know, it's very exciting being part of something new as well. So I suppose they were kind of my motivators to go into the PA profession. And then, like anything, you know, like I'm sure you've done, you know, you've researched the profession, and you know, from working as a nurse in ICU for so many years, you know, the medical teams are rotating constantly, and I did spot that niche for continuity of care. You know, apart from the consultants, every other doctor was rotating, and they'd all come from different hospitals where things are just done differently. So I really saw the importance of the continuity of care aspect, and I think I was like, this is great. This is something that we can, you know, we can build on, we can work on, and at the end of the day, it's all about, you know, being able to provide the best possible care to your patients, and you know, increasing team efficiency will get stuff done quicker, you know, which both patients, hospitals, and clinicians really appreciate. So yeah, I don't. In terms of like kind of the course itself, very enjoyable. It is very fast paced. I've just come out the far side of it now, and I'm due to take a post in general and breast surgery in 2 weeks' time. So I'm very excited for that. It's completely new to me, and it's certainly something I'm very excited to get skilled up on and knowledge about, and it's certainly exciting time in my life. But yeah, it's intense, it's fast, you know, but the faculty, the PA faculty that are there are fantastic. They're always there. They drop off an email to help you out in any way they can, and the amount of resources that are available to you is pretty much unlimited. The first, certainly, I think from my experience, coming in from a clinical background, and I'm sure there's probably nurses and kind of science backgrounds that are coming into this. From a nursing perspective, I found, particularly in the first kind of 6 months, it was a lot of kind of very kind of grilling science-based stuff, which, yes, certainly we do in nursing, but not to the kind of same depth. So I found kind of buddying up into study groups was essentially how I got through the program. And I would advise like buddying up with people, say some people with clinical backgrounds and science backgrounds, because certainly for the aspects of pharmacology, the girls who had a science background are phenomenal in teaching the biomedical pathways, which are so crucial to understand how that drug works and how it's kind of metabolized and excreted. Whereas I could definitely, what I offered them was just a bit more kind of knowledge and teaching around the clinical aspects, such as clinical skills assessments, because that's something I would have kind of done quite a lot of. So I think that the combination of having people from science and clinical backgrounds was phenomenal. So I'd advise you, whoever does decide to come on board, to really engage with someone who has a different background, because to be honest with you, it's great, the faculty are phenomenal at teaching, but there's a lot of peer-on-peer teaching as well, and we certainly used each other, exhausted each other from a resource perspective, but the learning was unbelievable from kind of teaming up that way. But yeah, the first kind of 8 months is very intense. It's an awful lot of information. I suppose what you need to do is just try find out what's clinically relevant, because it's not feasible to learn everything given each system. So I think you need to look and break it down and go, look, what do I really need to kind of yield from this particular topic, and just pick the most clinically relevant, important aspects of each kind of subject. That comes with time and certainly skill. You can, as time goes on, you'll get better at creating notes and discovering what's the most clinically relevant, and certainly the PA tutors and faculty will point you in that direction as well. And then getting out into the clinical environment was, for me, that was kind of my almost, it felt like home to me, because that's kind of where I'm very much a practical learner, as I'm sure some of you might be as well, and having the ability to learn while on placement, I always found so much use from it, and kind of linking that theory into practice as well. It just condensed everything and made much more sense. I think anyone coming in, it's very enjoyable. However, it is tough, and you do need to work hard, but the resources are there, and certainly use your, if I can't concentrate on anything more, it's use your peers as well, because for me that was a kind of game changer. And in second year, the QIP, and clinical placement combo, it's tough, but it's manageable. And if you're enthusiastic and you're passionate about it, you'll fly through it. I don't know if I have anything else more to add, but if anyone has any questions at the end, I'd be happy to answer.
Thanks, Aaron.
You're welcome. Thank you.
Good luck with you and your job. Now, what I'd like to do is, because we have over 50 people on this call, I would like to use the chat function if people have questions. We'd be more than happy to answer general questions. And if you have specific questions related to your own particular background or preparation, perhaps we could use emails or sort of communication outside of this, because these questions should be broad about the application process, about the profession, things like that. So if, I don't know, Laura or Sean or Pauline could monitor the chat, we could open that up for questions now.
Sure, happy to monitor it. So far, there are no questions.
Okay. I would like to emphasize two things that you may have heard already, and maybe one of them is perhaps a concept that might be new to you, and that is this notion of training generalists. So the program is a very accelerated learning experience, and we train students in general medicine, which includes surgical subspecialties, internal medicine subspecialties, but also pediatrics, women's health, mental health. So when students go outside after graduation, you can essentially fit into any aspect of the healthcare system with a high degree of competency and sophistication relative to your knowledge and expertise. So I think that that's one of the things that's most important. As you see, Aaron came into the program with a critical care background, but there are, he could easily move into a general surgical position upon graduation. So you can see the beauty of the training model. So Sean, do you want to read out a couple of the questions?
Sure. The first one is really more about the clinical year. There's a candidate who's asking if from a nursing perspective, there's someone that's kind of in charge of kind of checking you in and checking in on sort of day-to-day things in the clinical environment. And is there equivalent role in the PA program? Right.
Pauline, do you want to take that?
Yeah, on some of the rotations, you will have clinical, I suppose, preceptor, if you like, in the physician associate graduates if they are on that service. But because you're part of the medical team, you will be working with the tutors that are already on the medical team and other senior doctors on the medical team, like your SHO or resident on that team. So if you like, we work within the medical team, so all teaching, as Paul said there, from intern teaching, I think Paul mentioned, so you will get whatever teaching is going.
Okay, thanks, Pauline.
So
Sean,
the next question? Yeah, the next question is from Barbara Connolly about, it's really about the fact that there's not yet a regulatory body officially in charge of qualifying PAs. And the question was, prior to obtaining their qualification and whilst they are registered on the program, are they already or should they be enrolled on a trainee category of the MVR?
Yes.
Go ahead, Pauline.
Yeah, sorry, Lisa. Yes, our students register on the Managed Voluntary Register, which is the MVR, straight away once they're students. So we track students and graduates through the Managed Voluntary Register. So we're getting ready for regulation, in fact.
Right.
Very good. This next one is from someone who, it sounds like they want to work in surgery and is just wondering, is there a route to surgery without maybe going through medicine? Is there a non-medicine degree, so to speak?
Not as a PA. A graduate of our program would be competent in surgery and medicine.
I think maybe the query as I read it, Sean, might be, is the PA program a route to surgery through a non-medicine degree? It's not that clear, but as Lisa said, anyone coming onto this program would need a science or health science degree to come on it.
Oh, yeah. Okay.
Yeah.
Someone's asking for maybe some clarification about the difference between PA versus NP in terms of scope of practice, if what other differences exist.
So I sometimes think about nurse practitioners, advanced nurse practitioners in Ireland so think of a journey to a destination, but people take two different pathways to get there. And I think of that as an analogy to how PAs and nurse practitioners are essentially working in the health system. Now, nurse practitioners have a variety of different requirements in order to join a program, to become a nurse practitioner. However, if you see them working side by side in the healthcare system, you may be unable to essentially differentiate because their skill sets are so closely matched. But what I would say is that I've reached out to a number of nurse practitioners here. I'm not that familiar. Pauline may have some more information, but they tend to specialize, I think, a little bit. And some could say that PAs are specializing when they go to work in surgery. But Pauline, do you have anything to add about this difference?
Well, first of all, I'd say, even aside the differences, there is synergy across both roles, as you said, Lisa. They're both working as advanced practitioners. But currently in Ireland, the nurse practitioner role is quite specialised. So if you go into an area, you can only prescribe for that area. and that your job is tied to that area for now. But with the physician associate, you can specialize in an area for a few years and then move to another specialty. And once you get prescribing rights, you'll be able to prescribe right across all the specialties. So yes. I would say that that's the big one in Ireland at the moment.
And I think with what we're seeing also is, you know, an interest by the government with Sláintecare to really transform the healthcare system, and that includes allowing individuals who are trained at the postgraduate level, perhaps, to train to work at the top of their qualifications. And that seems to be a message that's very consistent that we're seeing in so many other countries, the UK, the United States, you know, Germany, South Africa. I mean, this is not a trend that's isolated to just the Irish healthcare system.
There's this someone wondering the competitiveness of the program in terms of getting into the PA program. Do we have any numbers worth sharing on that? You
mean how many people apply?
Sure, yeah.
That might be a metric. I would say it's hard to reflect back on the last few years, and Pauline can certainly jump in, but recognizing that this profession is gaining popularity year after year after year. So if we were to say over the last few years, you know, the acceptance rate was, you know, maybe, I don't know, 50%, but recognizing that as the popularity increases, so would the competition, I believe, because we have as Pauline said, we are not mass producing physician associates. We are taking a very measured approach to the growth of this profession, because we want to ensure that when you graduate, there's a job waiting for you. So we are unlikely to admit a class, say, of 100 students. We only have 15 in the first year and 14 in the second year. So I don't see us admitting more than 25, perhaps, in the next cycle. And who knows how many people are going to apply? It's very difficult to project, but I can tell you that the popularity has increased significantly. Pauline, do you think that's reasonable?
Yeah, and it is competitive, and it's not just, you're not just admitted on your eligibility criteria from an academic perspective. You are interviewed, and we are keen to get people, as Paul said there, if you don't come into the profession with some compassion and wanting to look after patients, and Aaron and Emma reiterated that, well, we don't really want you. So we try and get that across at interview, you know, when we interview you. So that's a really important part. It's not just doing a master's, it's actually coming into a new profession.
Right.
And the profession is dealing with vulnerable people like patients. So we're very keen to get the right people in. So we are picky, and it is competitive.
Thank you, Pauline.
In terms of what sort of education or professional background would be better, as someone is asking, is nursing versus science, you know, which one's more helpful in terms of the being in the program itself or maybe thereafter?
Pauline?
I would say, just Lisa, based on just from an Irish perspective, I'm sure you have more to add, but from what I've seen, it's actually just pros and cons of both. And I suppose Aaron alluded to it there, coming in from a healthcare background, you're quite comfortable in the clinical side of things and clinical skills. But this program is quite different in that you do need to understand the science of how drugs work, etc., etc. So the people with the science background bring a huge amount to the program and then learn the clinical side from their colleagues. So we've been lucky since we started the program, we've had a mix of both, and the students very quickly work together. So to be honest with you, I find some people come in from a healthcare background, maybe have too high expectations of themselves, and then find it difficult for that reason. So I think there's strengths to both sides.
Right.
Yeah.
I agree.
Yeah.
Okay. There's someone who's wondering, if you finish the program, become a PA in Ireland, can you work outside of Ireland after that?
At the current time, no. However, there are discussions, and have been discussions for quite some time, about perhaps some level of reciprocity with the United Kingdom. And our exam, our national exam, when it was written, we had PA experts from not only the United Kingdom, but also the USA participating in that exam writing committee. The PAs in the UK are undergoing their own sort of journey to regulation right now, and until that is completed, there won't be any reciprocity. So at the current time, I don't think the PA model is one where there's a tremendous amount of, how should I say it, transience. You know, we look at things as training healthcare providers for the local environment. And so we all have heard the expression brain drain, which was, you know, coined after so many physicians and other types of healthcare providers leave their countries to go to other countries where they might have a expectation of higher income or more opportunities, and that leaves their home country relatively deprived, if you will. And there's a lot of investment that we're putting into you as a clinical provider, and it's not that we want to, you know, claim that we are establishing borders for professionals, but it does, I think it's important to recognize that we're a partner in helping to strengthen the Irish healthcare system.
And if I could just add to that, Lisa, is on that point, I suppose, just to reiterate, I suppose the RCSI mission in setting up this programme was to train physician associates to introduce the profession here. So basically, we're not training people for export. I know that's a crude way of putting it, but you will see on our entry criteria that you must be able to work in Ireland before you even apply to the course.
Right.
So we're not taking people in on the programme who do not have a work permit to start off with, because
Right.
This is our expectation. We're taking small numbers in. We want those small numbers to be employed afterwards. And I see a query about employment. All our graduates have been in employment, and we have a very recent group of graduates, and it looks like they'll all be employed very shortly as well.
Okay. There is someone who's asking if you're still enrolled in your undergraduate studies and you haven't yet, or you won't be finished until after the application window closes. Is it still possible to apply?
Pauline?
Yeah, it is. Yes, it's still possible to apply. You note that in your application, and you will need to send us the transcript, ideally before you're interviewed. But even if you still don't have it at that stage, and we can still interview and ask for the transcript. So that happens. Yeah. And we've dealt with that before.
Yeah, and I think it's important just to remind everyone that we run on an atypical academic calendar. So we start our program in January, and it goes, as Pauline said, for 2 full years. And that is done so that students can afford themselves the opportunity to get experience in the dissection lab at RCSI, as well as availability of clinical placements and things like that. So we tried to strategically position this program in a way that gives students and allows students to afford themselves of everything that the institution has to offer.
Okay. There's someone wondering what comes after PA, meaning do you, should you, can you enroll in other programs? And I'm wondering if maybe they don't understand, you know, sort of the concept of the profession. And I think they're alluding to, is there a next level up that they should be following?
So I think, you know, I would say that as a PA trained at the bachelor's level, this was many years ago, I completed a graduate degree in public health and then a doctoral degree in education. I think that education is one of those sort of defining experiences in your life that you pursue things because you have a passion. And while the physician associate program in and of itself is a graduate degree, there are there are no programs as of yet that are specific for PAs where they can do a postgraduate qualification in a particular field, like in intensive care or critical care, or and surgery or anything like that. But that's the beauty of the PA profession. There are always opportunities to create things, and it doesn't, there's a master's in human factors and patient safety here at RCSI that you can also enroll in as I think a postgraduate qualification certificate or something like that.
Yeah.
But there are plenty of PAs that go on to take leadership positions. They manage departments. They are involved with education. So the clinical role is really just the stepping stone for you to move forward in a career.
Yeah, and I might just give one example, Lisa, of one of our graduates who's working in one of the hospitals at the moment, and he's keen to do a course on endoscopy because the consultant wants him to further his skills in that area. So absolutely, as Lisa said, this is the starting point and the stepping stone. So depending on where you find yourself, you will be able to avail of further courses. And as it turns out, that course is in RCSI as well.
And I would just like to mention one thing, and that is, and I get this question asked very often, is this a stepping stone to medical school? And I would like to say that if you desire to be a physician, then you should apply to medical school and don't take up a spot in a PA program. It isn't like becoming a PA is going to give you an edge in getting into medical school. And I think that one of the things that you need to reflect on is you have a skill set and a level of education that you're going to build on. But if your career goal is really to be a physician, then do not spend 2 years and the money on a PA degree. It is not seen as a stepping stone. We are our own career, we are our own profession, and it is, as you've heard from our students and graduates, it's one that has a high degree of personal satisfaction.
Very good. There's a candidate wondering if previous clinical experience, what would be sort of typical of the students that have gone through the program so far, and maybe what would be recommended in terms of the best background for the program.
So I think Pauline's talked a little bit about the pros and cons, but I do think that if you're looking to get clinical experience, there are a variety of different ways you can do it. Pauline might have a little bit better insight. I know there's a healthcare assistant is it a training program or is it an apprenticeship? I'm not sure. But
you would need to do a training program for that for healthcare assistant. Yeah.
And we do have students with that background.
Yeah, we do have students who have done science and have also then worked as a healthcare assistant. So that would be very relevant experience. It is difficult at the moment, I know it's different in the US from what I understand, to just go and try and shadow somebody. We don't have those facilities at the moment here, or experience without actually doing a program and working as some kind of healthcare professional. So I mean, I think we answered that one. It doesn't matter if you come from health or science, really.
Yeah, I think COVID has changed a lot.
Yeah.
And the opportunities for like volunteering, but there are plenty of opportunities to interface with different vulnerable groups as a volunteer. And we recognize that that is something that really does, I think, provide students with important life experiences so that you understand who comes to the healthcare system and why. And any experiences you have in your life, whether it's working with the homeless or the people experiencing mental health issues, those are experiences that I think really help to propel you and become much more sensitive and compassionate as a clinician.
Okay, some logistics questions. This one, I don't know how to say this right. Is this modular based versus ad initio?
Yeah, I saw that query. That's just going back to what I was saying about the program, that you do the modules simultaneously. So I think your question is, can you take it on a modular basis, which would mean you do the module and then leave the program? The answer is no. Because if you were to come in and do foundations of clinical medicine all day, every day, you would be running down the street after a day. There's so much, it's so intense, but maybe Lisa wants to add to that.
No, and I think one of the other things is that students have to understand this is not a part-time program.
Yeah.
And it's impossible to work when you're doing the PA program. So I think that you have to recognize it's a full-time commitment.
Yeah.
And then for those students who are from English as a second language, the testing requirements coming into the program, are there requirements like the IELTS exam?
Yeah, that's on the website. Yeah, there's information there on the website, but not only the language requirements, that you still need to think about the working, if you have a working permit or you can work in Ireland. There's no point in fulfilling the language requirements if there's still an issue with the working. Mm-hmm. You have to have everything, all the eligibility criteria.
Okay. Do we offer neurology rotations?
Yes.
Okay.
In year 2. Beaumont Hospital is our national neurosurgery unit for the country, so of course, yeah, in year 2.
And what do you think about, for someone who wants to work in general practice, what does the landscape look like in the next few years for working in that environment?
Very exciting. I mean, we are amazed at the interest in utilizing PAs in general practice environments, and we have a lot of support in that area. So I think with an aging population of GPs that the country is facing, it's just not us, it's Northern Ireland, it's Great Britain. Everyone is looking at this as a problem. And I suspect that if you have an interest in general practice, you're going to have a position, that's for sure.
Okay. There are several queries about best experience, best coursework, that sort of thing. You guys have sort of addressed this already, so I apologize for skipping over. But if someone has a particular interest, you can always email us or ask us on a one-on-one basis. Some more licensure issues about reciprocity with Canada, US, Australia, etc. So I'm going to skip over that. Time spent for human anatomic dissection.
Well, it's been a little different because of COVID, but I do believe that under normal circumstances, it would probably be about 2 hours a week, Pauline?
Yeah, about an hour and a half, we'd say, Lisa. 30 hours in dissection and 30 hours in lectures, generally speaking. Yeah. Or a bit more, actually. Yeah, but about that anyway. Yeah, 15 sessions.
Okay. Sorry, I'm trying to catch up here.
That's
There's
okay.
Several of them. There was another question about being able to work while you're in the program, and I think you kind of addressed that already. It's really not an option. So someone is saying, it was mentioned earlier that PAs work 9 to 5. Are there positions whereby a PA works nights in the ER/ED?
I can't speak to that. I know we have PAs in the ED. I think they have a day shift position, but that's not to say that hospitals in the future may suggest that we want PAs working evenings in the ED. I think at the current time it's limited pretty much Monday through Friday, but maybe some weekends as well.
Yeah, I might just add to that. Aaron mentioned that about 9 to 5. So currently, for patient safety reasons, as well as everything else, I suppose, until the profession is regulated, we're veering towards 9 to 5 jobs, and that's what we've been guiding consultants and organisations on, and that's it. But that will change during COVID. The PAs were very flexible and worked weekends and evening shifts and everything. So
yeah, and I would say that. When you don't go into medicine really thinking you're going to be working 9 to 5, because even if the job says 9 to 5, I can assure you that the PAs at Beaumont and everywhere else, they're probably working much longer hours.
Let's see, there's someone asking about scholarship for the program.
Yeah, We have scholarships, so we had a recent one offered by the BlackRock Clinic. We've other scholarships forthcoming as well. It depends on the year when you apply for the program. We know that some scholarships may come up, but that's out of our hands, if you like. The organisation will interview people, but you must have a place on the program before you can apply for the scholarship. So that's the big thing that people find hard to understand.
Right.
You know, they say, I apply for the program if I know that I'll get a scholarship to do it, but
Right.
you have to meet. Did I go mute? Sorry.
We can hear you now.
Sorry about that. So the scholarships are available, but you must get a place on the program first, and you know, you have to be interviewed, etc. So we do have scholarships available.
I think students should also recognize that you must come to the program also with the financing, because you cannot expect that there's going to be a scholarship waiting for you. The few scholarships that we have are competitive. Students need to interview for them. And if they don't get them, they have to have the financial backing or the support in order to pay your fees.
I don't know if this data is available, but is there a known salary range for working PAs at this time?
Go ahead, Pauline.
There has to be a benchmarking exercise done by the HSE for the salary of a physician associate before that's a formal salary.
Right.
But since we started the pilot project, we've given a benchmark of 40 to 45,000 per annum for PAs. But generally speaking, PAs are being paid around 45,000. That could change, and then when you go into the private sector to work, it's up to the private sector. They have more flexibility. Right. So it hasn't been benchmarked really is the answer yet. It will be.
Yeah, we're working on that.
Yeah.
So this next one, it has been asked a few times, and now it's being thumbed up by other folks. I believe it has been answered, but maybe I'll just ask it specifically. I might have glossed over this. What type specifically of clinical experience is needed to apply for this program, and how long would the clinical experience need to be? I think they're looking for very specific job descriptions and numbers.
Well, we don't have an absolute requirement for clinical experience. However, we practice what some might call a holistic admissions process, and we look at everything that is provided by the student on their CV, their work experience, their life experience, and their academic performance. So I think that while in some places, the US as one example that I'm familiar with, you know, there are absolute requirements. Some programs you can't get in without 1,000 hours, 2,000 hours, and you have to have it at the level of, you know, they list the types of experiences, but we don't have anything like that.
Okay. Someone is asking about the SUSI SUSI postgraduate grants.
Go ahead, Pauline.
Susie. Do I have to? So this is a SUSI grant, is a postgraduate student grant. However, it's up to the people at SUSI to add programs that are eligible for grants. And to our knowledge, since we set up this program in 2016, they have not added any new programs for eligibility for grants. So we've done all we can from an RCSI perspective. We've engaged with them every year through our contacts in finance to try and get our program added. So hopefully they will in the future, but we've done all we can. In the meantime, we have spoken to Bank of Ireland and AIB to offer interest-free loans to our students. So if you go to any of those banks and tell them about the program you're doing, you should get an interest-free or a very low interest. Now, again, everything will change after COVID, I'm sure, with banks as well. But that's what we would advise you to do. However, when people come on the program, it is a postgraduate program, and the finance department at RCSI are very good at agreeing a financial plan with students. So if it's a thing that you cannot pay your full first semester fees, You then talk to student fees and you say, can I arrange a financial plan? So they're very good with students in doing that, particularly at postgrad level, when you don't have the time and hours to work as other students might.
Okay. There's someone asking, is the expectation that you'll go, when you're finished with the program, go straight on to full-time employment as a PA? Is this something that you could do part-time or per diem, that sort of thing?
So I would like to take this because I think that what you have to understand is that we are developing lifelong learners, and going directly from the program to a part-time employment setting. First of all, I don't think we have any of our graduates working as a part-time employee.
No.
And
No.
second, the first 2 years or so after you finish the program, you are still learning. And I think you have to recognize that if you're going to have a career as a PA, to think that you were going to work part-time afterwards could potentially limit your marketability, as well as your, sort of furthering your competencies. But I recognize that everyone wants work-life balance, and there are circumstances that might prevent you, but you may have a hard time finding a post as a part-time PA. Don't you agree, Pauline?
Yeah, I agree that, Lisa. However, I'd say there is flexibility in the hours that our current graduates are working. So some of our graduates I know for sure work 4 days a week, and they work four long days, and then they have one day each week off. So it's a matter of negotiating your hours with your consultant. That is possible to do.
Right.
Yeah.
So there's going back to working, I'm not sure it's been emphasized enough because there's several more posts about, well, what about working on the weekends? I think the concern is being able to pay for cost of living and other day-to-day expenses, but there are still more questions coming in about, can I do some work on the weekends, night shifts, that sort of thing during the program?
I would say that occasionally we've had some very high-performing students have a job on Saturday where they, spend the day working in a, whatever occupational role they have. But I can tell you that if you start to experience academic performance issues, then any employment is going to compromise your success. And so that's why we strongly advise students not to work. But we do have some students that have worked one day on the weekend and it hasn't interfered, but these again are very high performing students. So.
Okay. Let's see. Oh, so in terms of regulations and regulating the profession, do you have a sense of what the timeline looks for that before we're sort of finished with it and it's all set up, and as well as prescribing? Is that something that's in the future?
Yeah. So I think as far as regulation, we are not unusual in our history here. The United Kingdom has been almost 15 years now, I think, training PAs, and they still are not regulated. Regulation requires statutory changes. It's a legislative activity that can be quite arduous and takes up a lot of time. So to put a time frame around when we expect legislation or regulation to be available to PAs would be somewhat foolhardy, but the ISPA, along with the faculty here at RCSI, we are diligently trying to work with our government partners to get the profession recognized and identify the regulatory body that would then provide the structure. But until that happens, the ISPA is it's not a regulatory body, but it's a professional body that manages the national exam, they manage the voluntary register, and those are two of the key components to the regulatory process. So that's a long-winded explanation, and I would say it would happen probably between 5 and 10 years. I'm being quite realistic.
Some folks asking about different areas that PAs can work in after they're done with the training, opportunities in psych or mental health, and anesthesia is another one.
Yeah.
Polly?
Yeah, again, it'll take time for these areas to really take off with the physician associate role. We did have some psychiatric nurses come on the program, and while one of them did get, funds paid from their mental health organization, there was a change of leadership during the time of the program, so they didn't actually give that student a PA role at the end of the program. So while they can see the benefits of the role, I think it will take time for it to get into the other specialties like mental health. I think we need to, get more people in the general side of things before that. Having said that, our Obs and Gynae Hospital in the Rotunda, they have seen the light with PAs and they're very keen to get a PA. They've given a scholarship to one of our students, so they will have a PA within the 2 years. So that's Obs and Gynae. It can change. It's
Right.
hard to know.
Okay. There's a few more sort of questions of logistics. Someone is wanting to know, does assessment look for evidence of reflective learning, question mark, a logbook, question mark, and then there's someone after that that's asking about a passport for clinical skills, maybe just sort of how do they keep track?
Right. Well, I think the passport for clinical skills, certainly, I don't know if that's on the website, but you can get a sense of what students are trained in. And you have to understand, education is evolving. Just because that passport exists now doesn't mean it's going to be the passport for next year. Yeah. But it's what we have now. And those are venipuncture, phlebotomy,
catheterization.
Yeah, catheterization. All that. Very, very similar. Suturing. So, and the other question about reflective practice, yes, we don't require students to have a logbook on clinical rotations, but you should, as a student who's a motivated and self-directed adult learner, reflective practice does help in your professional development. And there are instances where we do require students to write a reflective piece on a particular exercise, but it's not required at this time.
Just for the participants, there's been a few questions about language requirements, degrees from outside of Ireland. I think those are really more on a one-on-one basis. Right. So if you could, please just email us and we'll deal with that individually. There is a good question about the risk of if PAs do not receive regulatory regulation, what happens then? And they sort of cited the case of Australia where it started there and then it kind of didn't go anywhere and now those folks are unable to find work. Any thoughts about what happens in that situation?
Well, all I could say is that I was relatively familiar with the Australia experience, and sometimes you are at the whim of government, and that particular program was started and lost support relatively quickly. I would say here we have the benefit, I think, of physician champions. That's what I like to call them, because so many Irish physicians and consultants have trained in the US, as Pauline said, in Canada. They're very familiar with the PA role, and these are some of our biggest champions. So I do believe that the more PAs that get put into the healthcare system, this is a small country compared to Australia.
Yeah. And to add to that, Lisa, we took the approach even very different from the UK. So I was going to say on Lisa's point of regulation, I would hope we get regulated sooner because we engaged with the Department of Health at a very early stage and we got their agreement to carry out the pilot project. We got their agreement to set up the programme. Right. So I know in the UK they did it differently. They did it from the ground up, from a clinician side, but we actually went from the Department of Health that way. So we have been told verbally by people at the Department of Health and at the top level in the HSE, we need you to get more graduates, PAs. This profession is not going away. It will take time for the Department of Health to recognise this profession as in regulated. But we, like in RCSI, we wouldn't continue to run the programme and, you know, qualify students if we didn't have this kind of, knowledge in the background that we have the support of high-level HSE and Department of Health. But as you can imagine, so many things have happened since we had this pilot project with cervical smear debacle, one thing after the other in the Department of Health. It has delayed progress in this pilot, but it's not going away. The PA profession is not going away in Ireland. But we have done everything that the department asked us to do in the way they wanted it done.
Okay, yeah, that's a good clarification.
So there's just one person with their hand up. I know they've raised their hand before. So Dominic Parkinson, if you'd like, you can unmute yourself. While you're doing that, there is another chat message about salaries. We already know from a previous question, there's not a lot of data available on that yet. It was about, are the salaries increasing over time? My assumption is we don't have the data yet, but Pauline, you can comment.
Right. But the intention is to have a scale, a salary scale. That's why I'm saying the benchmarking hasn't been done, and once it is, there will be a salary scale. Yeah.
So Dominic has decided to chat. Okay, it's looking at how many are called to interviews. How are the interviews conducted? What does that look like?
Yeah, I think what we're going to do this year is, because of the popularity of the profession and the increased interest, we're probably going to have 2 rounds of interviews, one in mid-June and one in September. And we anticipate that, you know, we may have, it's hard to say how many people will be interviewed, but I suspect we'll interview at least 50 people. Based upon how many people apply, but I don't want to hold myself to any absolute figure.
Someone else just asked, based in recent staff shortages in hospitals, and I think that's in reference to what's happened in the last several months with COVID. Are you seeing more demand for PAs in those Irish hospitals now, and going forward, do you expect to continue to see that?
I think what we see is the uptick in interest in what PAs bring to the healthcare system. And because of what they bring, such as flexibility, continuity of care, high skills, high level of professionalism. But I do think that COVID has also exposed some vulnerabilities in the healthcare system itself. And as a result, people are much more intrigued by the concept of a PA.
Yeah, and I suppose I'd just like to add to that, it would be great to get a variety of students in our next cohort from right around the country. Yes. Because sometimes I have jobs that are there for students, but it's a matter of relocating for the job. You know, it might be Galway, Cork, and if we don't have students from those areas, sometimes the students are not inclined to take up the post. So, when you ask, are the graduates all in employment, they could all be in employment if the job was right beside them, but there are sometimes jobs that are unfilled because the graduates don't want to relocate. But there is a huge interest out there at the moment.
Right. How about one final question, Sean, then we can wrap it up.
Sure. Let me just switch back. A little bit about the assessments. We have 2 sets of exams to complete before qualifying. And sort of what does it look like in terms of assessments during the program and then afterwards as well in terms of qualifications?
Well, there are, as Pauline said in her slides, there are a lot of assessments that take place across the entire curriculum, and they vary from MCQs to practical exams. So I would say that on average, maybe high stakes assessments, maybe every 5 to 6 months. Is that right, Pauline?
Yeah. The end of each semester.
The qualifying exam for the national certification is at the end of the program, and that's administered by the ISPA. And they have their own set of continuing professional development requirements that must be completed in order to maintain your certification, and that's 50 CPDs a year, and re-examination every 6 years.
I think just on that question as well, Sean, as I'm reading it, is that if you complete the RCSI exams for the masters, can you then go and practice? And then is there another set of exams in the national exam? So when you have your masters complete with RCSI, you can go into practice, and then you must take the national exam at the next sitting of that national exam.
Right.
So the answer is yes, you do have two sets of exams, the one for the masters for RCSI and then the national exam, but you can work in between depending on when the next national exam happens. For the recent group of graduates, it just happened that the national exam was scheduled soon after their RCSI exams.
Right. All righty. Those were terrific questions, and thank you, Sean, for moderating it so well. And just in closing, we are thrilled with your interest in the program and are more than happy to answer any specific questions you might have relative to your own particular application or qualifications to apply. So don't hesitate to reach out to us at pastudies@rcsi.ie. On behalf of the program, I'd like to thank all of you for your interest and your engagement this afternoon, and a special thanks to our students and our graduates. Take care. Have a lovely weekend.